I'm definitely a cheerleader for my patients. I think that's really important. I think change is incremental. It's hard. Sometimes we make great changes and they're hard to sustain, but when you have a support system in place, it's easier to sustain those. Hi, I'm Dr. Colleen Amann-Shah, and I'm a naturopathic physician. I've been in practice for 13 years, and for the last 9, I've been mainly practicing acute care, but my area of interest is more women's health and perimenopause. I'm excited about, as I mentioned, women's health, perimenopause, but also just being able to establish more of a relationship with my patients. I really want to follow patients throughout their health journey. And when you have a relationship with someone who can kind of coach you and help you on that journey, those changes become more sustainable and health outcomes are better. I'm nerdy and I love really delving into like the minutia and the biochemistry of like what's happening with an illness or what's happening in the body. I think the 4 most important things a patient can do are focus on their sleep, getting good quality sleep, focusing on their nutrition, so eating what I call real food the majority of the time, getting out and moving, and stress management. And I think all of those things, I do prescribe medication. I may prescribe naturopathic therapies as well, but really focusing on those 4 things will get you a long way. Even if we did nothing else, if you could improve those 4 things, your health overall would improve. Really, sleep is one of the most important factors in your health. Crucial for hormone regulation, especially stress hormones. It's where our brain heals and basically detoxifies. And so sleep is super important. And we don't have a culture that really honors or rewards people for sleeping. We have a go, go, go culture. I do tend to lean more towards traditional medicine in terms of treatment plans when they're necessary, minus the lifestyle. Naturopathic medicine really focuses on lifestyle, and we have the time to coach people on that. Whereas if you see a traditional medical doctor, they might have 15 minutes with you, and the only thing they can do in that time is a brief, here's a medication, maybe a brief mention about diet and exercise. But what excites me about naturopathic medicine is more that we have the time to focus on lifestyle. I think it's really important for a provider to meet patients where they are. If somebody really does not want to do medication, I'm going to talk to them about other alternatives. If they want medication, we'll talk about medication. I want to give them both those options and explain why. If somebody is at high heart disease risk and I'm concerned that they could have a heart attack or stroke in the next 5 years, I'm probably really going to suggest that they be on some type of medication for that. But if they're absolutely opposed, it's not my job to boss patients around. It's my job to give them the best options and meet them where they're at. When I'm not doctoring, this isn't very doctor-like, but I am undergoing wine certification classes. I'm really passionate about wine, not just drinking wine, but learning how wine is made, how it's grown. One thing that has changed for me doing my wine certification training, maybe doesn't apply exactly to naturopathic medicine, but it's definitely made me slow down and approach things more thoughtfully. Because when you're wine tasting, you're smelling, you're tasting, you're trying to discern small little notes and differences. In life, you kind of have to slow down and be thoughtful and mindful to discern things. Thanks for taking the time to listen. I look forward to working with you. If you're interested in working with me, please call to schedule an appointment, 503-855-4341. Thanks.